Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today I want to talk about, does the intensive care team only tell you half of the story? Now, the quick answer is absolutely yes. And why do I say that? So intensive care is a highly specialized area. It takes years of studying, years of training, and then years of practice to understand intensive care inside out. Whatever the intensive care team is telling you about your loved one's condition and treatment is not even half of the story. So why do I know that? Because I've worked in intensive care for over 20 years and I've been consulting and advocating for families in intensive care for many years. I have been involved with thousands of critically ill patients over the years, either as a nurse in intensive care or whilst working with my clients here at intensivecarehotline.com. So I see all the time that, when families first approach us here at intensivecarehotline.com, they tell us about their loved one's condition, or so they think. And when they tell us about their loved one's condition, we're always finding the intensive care team has left more than 50% out of the condition, the treatment, more importantly, the treatment options. There are so many times where I can see straight away that you don't know what you don't know. You don't know what to look for. You don't know what questions to ask. And you don't know how to manage doctors and nurses in intensive care. Without knowing what to look for, without knowing what questions to ask, the intensive care team will have the upper hand. They can do whatever they like. When someone is in intensive care, there are dozens of things happening simultaneously. And unless you are looking at those things that are happening simultaneously, you will never understand the full picture. And here at intensivecarehotline.com, we can give you more or less a crash course in intensive care, what you need to understand as a family member who has a loved one in intensive care, so you can make informed decisions, have peace of mind, control, power and influence, and so that you're not beholden to the intensive care team's opinion. So that is my quick tip for today. If you have a loved one in intensive care, check out intensivecarehotline.com. Call us on one of the numbers on the top of our website or on one of the numbers below this video, or send us an email to support@intensivecarehotline.com with your questions. Like this video, comment below what questions that you have, and subscribe to my YouTube channel for updates for families in intensive care. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.